Well, new at 5, an urgent call for help as local health officials signaling an SOS. Local hospitals continue to see a surge in COVID cases, and that includes among the staff. Hundreds of healthcare workers are getting sick as hospital beds fill up. Our Liv Johnson live at CRMC tonight, and Liv, the level of concern reaching a whole new level tonight.
Yes, that's true. All the doctors I spoke with today told me you really don't understand how dire the situation is until you get behind these walls. Not only is there an influx of patients into the hospital, but there's also a record number of staff members who are testing positive for COVID and having to take sick leave.
This is the worst that it's been.
David Bacci, the regional vice president of the Hospital Council of Northern and Central California, located in Fresno, describing the extreme staffing shortage hospitals are experiencing as the number of COVID cases continues to surge.
Today, I have 284 employees that are out on a COVID leave of absence.
We have over 10% of our staff and faculty and residents out with COVID.
It's more than 100 hospital employees, at least more than 100.
Over the weekend, these hospitals sending out an SOS. Kaweah Health in Visalia reporting a 101% occupancy on Monday, with 29 patients in the emergency department waiting for a bed to open up. But Dr. Kenny Bond with UCSF Fresno says it doesn't matter how many beds there are if there's no staff to take care of the patients.
It's not even about having beds, it's about having nurses and respiratory techs and doctors that can take care of you. If you don't have that, the bed by itself means nothing.
Bacci says ambulance providers to these hospitals in the valley have stopped transporting non-emergency calls to the ER. He also says the hospitals are relying on travel nurses to help them keep up with the influx of patients as they expect the number of COVID cases to continue to rise until March.
Our hospitalizations, they come about 2 weeks after a lot of the positive numbers are starting to show up from people who have tested positive. Those numbers keep increasing still day after day. And so we expect that our COVID hospitalizations over the next couple of weeks are going to potentially double.
Doctors told me the good news is last year during the Delta surge, it seemed like patients stayed in the hospital for an average of 2 weeks, whereas now with the Omicron surge, it seems that average is going down to about a week in the hospital. But still, they're asking everyone to please help them out and get vaccinated and practice COVID-19 safety protocols. Live in Fresno, I'm Liv Johnson, KC24, local news that matters.